Hey, I'm Kyler Norris. We're going to be doing the anterior drawer test. So in order to do this test, we need her hip at 45 degrees and her knee at 90 degrees. I'm going to be sitting on her foot so that when I do the test, we can feel if there's laxity or not. So we'll be doing a bilateral test. This test is to help determine if she has a sprained ACL or not. So I'm just going to pull towards me right here. I don't feel any laxity there. So that one is good, but I'm going to compare it to the other leg. And they both feel fine, so that's a negative test. Alright, so we're going to be doing a posterior drawer test. So for this test, we need her hip at 45 degrees and her knee at 90 degrees. I'm going to just be sitting on her foot so that I can test to see if there's laxity. So we're going to be doing a bilateral test here. This test is to help see if there's a sprain to the PCL. So I'm just going to put my hands here and just push to see if there's any laxity. And there's not there, so we'll test this other leg. Alright, and there's no laxity, so that's a negative test. Alright, so we're going to be doing the lever sign test here. So we're going to have our patient sit with her legs straight. We're going to be testing this right leg for an ACL sprain. So in order to do this test, I'm just going to place my fist under her calf muscle here, and then I'm just going to push right above her kneecap. And so we can see that there's foot movement there, which means it's a negative test. If there wasn't foot movement, it would be a positive. But here is a negative test of the ACL sprain.
I'm Andrew Richardson. Today we're going to be doing the anterior Lachman test to test for an ACL sprain. We're going to be testing to see if there's laxity, so it'll be bilateral. To perform the test, you put one hand under the distal thigh, the other hand on the proximal shank, and you push the knee down on the shank to see if there's laxity. We'll test bilaterally to compare, and there's no laxity, so that would be a negative test. Now we'll be doing the posterior Lachman test to test for a PCL sprain. We'll be testing bilaterally. To perform the test, you put hand on the distal thigh and under the proximal calf. You push down with the hand on the thigh and pull up with the hand on the calf. If there's no laxity, we'll test bilaterally to compare. And that would be a negative test because there's no laxity. Now we'll be doing the valgus stress test to test for an MCL sprain. We'll test at 0 degrees and at 30 degrees. To perform the test, you perform a valgus force on the knee to feel for laxity in the knee joint. There's none at 0. We come up to 30. No laxity there. And you'll do bilateral tests to compare. 0 degrees, no laxity. 30, no laxity. Now we'll be doing the bear stress test to test for an LCL sprain. We'll test both at 0 degrees and at 30 degrees flexion of the knee. To perform the test, you provide a varus force on the knee. This is at 0. We're looking for laxity to make it a positive test, and then at 30. And you'll test bilaterally to compare. 0 degrees and 30 degrees. Here.
Alright, I'm Kirsten Bakes. I'm going to be doing the Apley's meniscus test to test if he has a meniscus tear. In order to do this test, you're going to have them on their stomach in a pronated position, and you're going to want their knee at 90 degrees. And then you'll push down on the heel right here and do an axial force, and then you'll be rotating it medial and laterally. And in order to have a positive test, there'll be pain in the meniscus. Alright, now we're going to be doing the McMurray's test. We're also going to be testing the meniscus to see if there's been a tear. So in order to do this test, you're going to lift their leg up, and then you're going to want to put your finger on the joint line. And during this test, in order to get a positive test, they're going to have pain, or it's going to be like a painful clicking in their knee, so that's something you're going to be feeling for. And to start this test, you're going to go rotate their foot medially, and then you're going to go through the full range of motion on their knee, checking for clicking or any pain. And you'll do that, and then you'll go laterally, also to test the medial and lateral, and then you'll go do the same range of motion. Alright, now we're gonna do the Thessaly's test, and for this test, you're gonna have them stand on one of their feet, and they're gonna bend their knee slightly, and while they're bending their knee, they're gonna rotate their leg, keeping that knee in the same spot, side to side, testing for that meniscus pain. If they need it, you can obviously help them balance. And yeah, just see if they have any pain in the knee. Alright, we're gonna do the Nobles compression test, and for this test, you're gonna put pressure on their lateral femoral condyle. This is along where the IT band is, and you're gonna be testing for IT band syndrome. For this test, you're gonna put the pressure on right here, and then you're gonna go through the full range of motion. And for a positive test, they'll have pain right where you're putting the pressure on.
I'm Allie Hunsaker. I'm going to be doing the hamstring 90-90 test. So we're going to bring his knees up. I'm going to have him hold his knees in this position right here. And we're testing for a tight hamstring, so I'm going to have him extend one leg at a time. Okay, so it's definitely a negative test. You got that one pretty high up there. We're checking to see if it's less than or greater than 20 degrees, and then I'll have him do the other leg as well. That one's pretty tight. That one might be a positive test. Okay, relax. Good job. Okay, I'm gonna be doing the patella apprehension test. So I'm gonna have his leg flat. I'm gonna move the patella laterally. This is testing for a sublux patella, and what I'm looking for is apprehension or quad tightening right here for a positive test. Okay, I'm gonna do the patellar grind test. So what I'm gonna do is have his leg flat. I'm gonna put my hand above his patella and apply pressure and have him contract his quad. If there's a positive test, he'll have pain, and the pathology is patellofemoral syndrome or chondromalacia. Okay, I'm gonna do the sweep test. So what I'm gonna do, this is checking for joint swelling. I'm gonna have his leg flat, and I'm going to sweep up medially and laterally, looking for fluid or bulge under the skin.